Did you know that you can invest in a beautiful facelift and then actually lose your hair? Studies show that 5 to 15% of patients lose their hair as a result of getting a facelift.
Remember, I think of hair like planting seeds in soil. They're growing, but if you cut the roots off, and depending on where that incision goes, you can damage the hair. You could end up with no sideburns. There is no revision that's going to magically get the hair to be back to normal.
BeautySeek is not a medical provider. This is not medical advice. Always consult a licensed professional.
Today we're here with Dr. Mata, otherwise known as Dr. Scottsdale. He's a board-certified plastic surgeon and reconstructive surgeon. Welcome, Dr. Mata.
Thanks for having me.
Studies show that 5 to 15% of patients lose their hair as a result of getting a facelift. Sometimes it's temporary and sometimes it's permanent.
You're right. It's not uncommon for women to spend a lot of money and not realize that they might end up with permanent hair loss or hair reduction from having an actual facelift.
Why? Why is it?
Can adjust things, but the more you mess with the hair, the more likely you are to damage it or to injure it. It all boils down to fundamentally the planning that happens before the surgery. All the marks that a surgeon makes kind of determines what happens.
When you talk about marking up the face prior to surgery, can you share a little bit more about what you mean?
Depending on how the mark goes determines whether you end up with hair loss. Depending on how you're going to pull or basically tighten the muscle layer or the skin layer is how your marks are based. So typically I prefer to stay in front of the hair so I don't distort it. You could lose some of the hair, and we cut vellus hair, which is the fine little hair that like you have like baby hair. Because if you make that incision in front of that baby hair will still be there and you're going to see a scar. The goal is to hide the scar right at the hairline, which is called a trichophytic incision, which basically means you're cutting the hair follicles in such a way that I'm trimming the top, but the root is there so that the hair will grow through the scar. It can, if it's cut in the right way. Because remember, hair follicles grow like this, but everyone's hair is different. Some grow at an angle. And so depending on where the hair grows, if it's growing this way and you cut this way, you cut the hair, but the root is still there, i.e. the hair will grow through the scar.
Okay, great, good.
Next, we talk with Dr. Mata about a scarless facelift. If you know someone who is researching facelifts and wanting minimal scarring, share this video with them so that they can become a more informed beauty seeker.
Okay, because when I hear you say that you would go in front of the hairline, that almost scares me. I think, oh, I'll see my scar.
Yeah, correct. That's where you're making tunnels in the hair. And again, it's still hair. So when you make the incision, if you damage the hair follicles, you will lose hair up here. And just even pulling on the hair. I think a hair sometimes has dandelions. If you mess with them, they disappear. Eventually they grow back, but it takes a while. Anytime you're doing even an endoscopic, which means you're making incisions in the scalp, depending on how many, you're tunneling all this way to pull the skin. But if you have extra skin around your ear and you pull it up, it's just more bunch and it doesn't look good. So only specific candidates end up with what's called an endoscopic or a scarless facelift. And true scarless facelifts basically are avoiding this scar, and all the scar is back here, and all the lifting is done internally to pull things up.
Next, we talk with Dr. Mata about revision surgery due to hair loss after a facelift. If you are researching facelifts and potential issues as a result of a facelift, save this video so that you can come back later and reflect on Dr. Mata's hair loss lessons.
Do you ever have patients come to you and ask for a revision because they lost their hair? And is that possible?
I mean, you can always do a revision, but when it comes to the hair loss, there is no revision that's going to magically get the hair to be back to normal. So if the sideburn is up here, where this much of your hair is missing, there's nothing I can do to pull it down. I can advance it a little bit, but it's never going to be what it was. The only true correction for that is to do hair transplants. That's where you take hair from the back and you put it in the front. And that's a good way to fix it. Some people will be like, oh, well, let me just cut some more into the scalp and rotate it. And you can do those things, but now you're creating more trauma to the hair follicles. And so it's just easier to take hair and put it where it was at one point in time. Sometimes people will do it here where if you're not careful, when your surgeon makes this incision behind your ear, you get a step off. That's where the scar should follow the hairline. But sometimes they cut it into the hair, but you pull the skin and you end up with a zigzag or a little junction of missing hair. And
Oh my goodness gracious. So could do a hair transplant, but then that's a whole nother procedure.
and I tell patients, I'm happy to hide the hair here, but understand if you have a lot of laxity and I were to pull this up, think about it. If my sideburns here and I'm pulling this up, look at how much of my sideburn would disappear. And remember, that's just stopping here. If you have loose skin all the way up here, well, where's that incision go? Up here. So you end up with almost no sideburn depending on how it's marked. Remember, I think of hair like planting seeds in soil. They're growing, but if you cut the roots off, it's not going to grow anymore.
3 questions to ask surgeons.
What kind of questions would a beauty seeker ask their surgeons as they're exploring who to work with to get a sense of, will I have hair loss or not?
I think the one place you don't skimp on is the one thing you only get one of, which is you only get one body, one face. And so it's always best to do it right the first time, not the second time. It always goes back to the fundamentals. You go back and you see their website, you see that they're board certified, you see that they actually do facelifts. As a cosmetic surgeon, that could be anybody. That could be a dermatologist, internal medicine, OB-GYN, psychiatrist, anybody. And part of their certification is they have their own standards, but obviously they're different. Minimum training to be a plastic surgeon is 3 years of additional training. But how does a beauty seeker know? It's really, really simple.
1, can you do surgery at the hospital?
They say no, they're not legit. It's the easiest way to know.
2, where are the incisions?
Depending on where that incision goes, you can damage the hair. You could end up with no sideburn. Either you're going in front of the hairline or behind the hairline. It all boils down to fundamentally the planning that happens before the surgery. All the marks that a surgeon makes kind of determines what happens so that the hair will grow through the scar.
3, where's my scar going to be?
Depending on where that incision goes, you can damage the hair. I talk to patients like, hey, we're going to do a scar. It's going to be here, either here or here. Those are your only 2 choices. That's it. The goal is to hide the scar right at the hairline.
Okay, so we've learned today about where to place an incision, how to cut into the hair so that we have less scarring and we don't lose hair. We love that. That I need to just feel confident with whoever I'm selecting to be my surgeon because it's an investment. And I think you said the most expensive surgery is the one that you have to do twice.
And for me, it was always like, I want to see the patient to make sure they're doing well. I see them on day 1, day 7, 14, a month, 3 months, 6 months, and a year. And they always have a follow-up with me at least once a year for as long as they want to come for the rest of their lives.
Okay, great, good. I would like to give you a double thumbs up. This is amazing. The Beauty Seek community, needs this kind of education. Thank you for giving and sharing and also for being mission driven. I admire you and thank you so much. I appreciate your time.
Of course, happy to help.